Good evening, ladies and gentlemen. A very warm welcome to this groundbreaking webinar on the application of AI in ECG. My name is Dr. Roshni Chan Ganguly, and it is entirely my pleasure to introduce today's session. The ECG, as we all know, is an essential tool in diagnosing and managing cardiovascular conditions. However, interpreting ECG can often be intricate and time-consuming, with the potential of human error. This is where artificial intelligence becomes a pivotal ally, and AI, with its remarkable ability to analyze extensive data sets rapidly and accurately, promises to revolutionize ECG interpretation. We are privileged today to have with us an esteemed speaker, Dr. Mukesh Bhargava, a distinguished internal medicine specialist and the visionary co-founder of IM Care. Dr. Bhargava has dedicated his career to advancing patient care and innovating within the field of internal medicine, particularly in cardiovascular health. With an impressive background that spans both clinical practice and entrepreneurial leadership, Dr. Bhargava brings a wealth of knowledge and experience to our discussion. His clinical expertise is complemented by his keen interest in integrating cutting-edge technology into healthcare, ensuring that his patients receive the most effective and up-to-date treatments available. In today's session, Dr. Mukesh Bhargava will guide us through how AI-driven ECG analysis is being applied in clinical practice, the benefits it offers to patients and healthcare providers, and the challenges we must address as we move forward. Our moderator for the session today is Dr. Kamlesh Bhargava, who will be facilitating the question-answer sessions following the presentation, and the vote of thanks will be delivered by Dr. Srividya Raghavendran. Thank you, everyone, for joining us, and we look forward to an engaging and enlightening discussion as we explore the intersection of technology and medicine. Thank you. Welcome, Dr. Mukesh Bhargava.
Thank you. Thank you, Roshni. Thank you for that kind introduction. I'm deeply honored to be here today and grateful for the opportunity to speak to such a group. It's a privilege to share my insights on the practical applications of generative AI in electrocardiography. I would like to extend my sincere thanks to the organizers for inviting me on this Sunday meeting, and for all of you to having taken the time out on Sunday to do this and advancing the learning in medicine. I look forward to our discussion and hope to provide you with valuable insights that you can apply in your practice today. And the way I have planned this is I will provide you with my perspective of the current state, using ECG interpretation as an example, and we'll follow it up with a live and interactive demonstration on how it can be used today. And then we'll open it for questions. And I really like that Roshni said that this has the potential, but stay tuned of the pitfalls. This will be a balanced discussion, not a just AI can solve all of our problems. So I'll share my screen, and I'll use ECG as an example, but this is just a conversation starter thing. So the context, and this is a saying from Alice Moore's Earth. Yesterday is history, tomorrow is a mystery, today is a gift, and that is why it's called the present. So just keep this in context. We're talking about today. I will refrain from these predictions that folks around could be making that AI will do something. My focus will be on today, which is a gift for all of us, and especially after India having won the World Cup yesterday. So it is a gift. So what is a desired clinician? If all of you here have some interest in clinical medicine, and what we look for in a desired clinician is a person who is competent, who has an ethical practice. They are patient-centered. They continuously learn, which is evidenced by you being here today, such a august group of people who collaborate. The Setu project, the other things that you do, that is really collaboration that you didn't have to do, but you do. And then do it professionally with professionalism, and you always focus on quality improvement. That is a desired clinician. With that said, this headline came around in March of last year. They said the new GPT-4 AI gets top marks in law, medical exam, OpenAI claims, which means all of us in this room who are knowledge workers, who have taken some exam for certification, there's now intelligence around in a machine that will beat us at those exams. And the statistic was somewhere around 90%. So if this is true, does this mean that this will change and we will become irrelevant, meaningless, or doctors will be, or clinicians will be replaced by machines? So this got my interest when you say exams can be replaced, and then it is like, oh, maybe it can make better decisions. So with that, what is generative AI changing today? It is changing how medical imaging and diagnosis is done. Clinical decision-making support is being provided with that. Natural language processing, which is ambient AI, people just putting their phone in the middle of the doctor and the patient, records the note, creates your progress note, and even gives you advice what you should do. Drug discovery and development, virtual health assistants, bots or AI-powered bots are answering questions that folks would otherwise answer. Predictive analytics and population health management, fairly big field, and medical education and training, how to train the new doctor, the new nurses. Can we have simulators which are AI based with AI technology? So just to set, I saw Kamlesh had shared as what the audience is, and I said there I would share with you what is the difference between a computer program, artificial intelligence, and then subsequently generative AI. So really, if you think about it, a computer program was written by programmers. It was preset. The rules were set. If this happens, do that. Or if this is, if you type A, it should look this way. And it was a pre-programmed set of instructions that were executed by a computer. Artificial intelligence came about as a simulation of human intelligence by machines to perform tasks. And then what is the latest or the newest, which we most commonly known as ChatGPT or GPT, is generative AI, which is that it is a subset of AI that is focused at creating new content, data, and outputs, and based on existing or information. So it will create new information. It will learn this, and often in creative and novel ways. And it will do it faster than what we as humans can do. It learns patterns from data to generate new content. So this is where it is changing. So if we come to ECG interpretation, most of the ECG machines have an auto interpretation. That is a computer program. Most of them use some modification of what is called the MINS code or the Minnesota code, which has, these are the types of rhythms can be, and it classifies, it does a numeric tracing, and it is not bad. It is on a clean ECG, it can be fairly accurate. So what we are talking about is, where does this go after, once we know that the machine can provide a computer program to generate a report, but can artificial intelligence or generative AI do better? Can it ace that? So there are two use cases I would propose, and one of them is a clear winner, which is if you wanted to learn how to perform an ECG, if you wanted to have a framework of how to learn, you could go to a book, you could go to a teacher, but this is where artificial intelligence or the generative AI tools, whether you use ChatGPT or use Perplexity, whichever you use can help you learn. And because you can have a conversation back and forth, you can say, what is the criteria for diagnosis? Something, and I'll show you some examples. And then the second part is really analyzing the ECG instead of the human, or it is in addition to the human, or it is that the ECG is analyzed by machine learning and artificial intelligence, and the human says whether it is right or wrong. So what we'll do is literally think of what are the learning requests, and I'll do a live demonstration of this. But you could put in, please create a checklist for performing an ECG. And this is a simple ask, and it will give you a checklist for whoever wants to do an ECG, whether it is a doctor, whether it is a nurse, whether it is a technologist, and it will have step-by-step instructions, place the electrodes, etc. If you say to it, where should I place the electrodes? It will answer that question, and it will do it pretty accurately. If you do it in Perplexity, which is the brother of ChatGPT, it may even show you pictures sourced from the internet, but you still have to figure it out. So it will be a very easy thing to create a manual to how to do ECGs. You can say, please create a checklist for interpreting ECG, and you will find that it will either source it or create its own, or it will try to make that happen. You can say, please tell me how to analyze a P wave on an ECG, or create a table of differences between the right and left bundle branch block. So these are what we call prompts. What are you asking for it to do? So here's an example. The prompt was, tell me the type of P waves and tell me what they mean, and create it in a table, a 3-column table. And in the first column, put in what is the name of the wave, what is the characteristic, and the third, what the implication is. And 15 seconds later, you have the table out there. So you don't have to go open a book, find the index where they're talking about atrium and P waves and those kind of things. Within 15 seconds or less, you have a nice looking table, and it is for most part accurate. This is where it outperformed us in the medical tests, where is to find the information that is already there. Here is the difference between there are two versions of ChatGPT. One is you can go to chatgpt.com, and without paying anything, you can get what is called ChatGPT 3.5. ChatGPT 4.0 is the paid version. And if you asked about left bundle branch block, this is the only difference. The top column represents what you would get for free. The second column is 2 or 3 extra lines, maybe a little bit more, but it gives you a fairly good sense of what you need to do or what you need to learn in the free version. So then comes, the analysis requests. So we talked about in the first few minutes of you can learn how to read an ECG, which I think is very important. We'll come to the conclusion. But analysis, how can you analyze an ECG? You can use your phone, take a picture, and just say, analyze this for me. You can upload a PDF on your computer or desktop. You can, snip and paste, which will work quite well. The things to remember is when you ask for it, if your ECG is in color, the classic pink sheet with black, nice graph, it will be better than the black and white version. If you include the header, the auto interpretation that the machine spits out, it will actually confuse your large language model more, because it will try to put its own interpretation and what the machine said and try to say, okay, how can I have some kind of consensus between those two? This is what I found. And then noise versus artifact. So how did I do this? This was my personal experiment, and this is what I think got the interest of the organizers of the group. I took, I was on call. I had all the hospital's ECGs to read. I had 124 ECGs to be reported. I sat down, I said, I'll report them manually the way I do. And then I will snip and just put the ECG in a chat in the chat GPT and compared the two to figure out whether there was consistency, accuracy, patterns of errors, and if there were certain words or things that I would put that would make the answer to be correct. Now, of course, you are all science people with background, with tremendous education. You'll say, oh my God, this is a lousy study. There are many limitations. One person, no second umpire, sample size is small, and there are, of course, unconscious biases, whether I believe or don't believe, and I'm trying to double check myself. But those are the limitations. So generative AI was consistently it was the winner in consistency. It reported every single item, right or wrong is a different story. We'll come to that, but it said, oh, rate, rhythm, whether there's a bundle branch block, whether there's a heart attack, ischemia, whatever it is, it was consistent. It filled in all the check boxes. I would propose the human accuracy was superior. There was no patterns of errors that I found, and we'll show you the examples. The color and the quality of the ECG mattered. So if the ECG was in color, it mattered. And the funny part was when the chat GPT made an error, and I said, gee, what do you think? Why is this ECG not showing left bundle branch block? It said, oh, I'm so sorry. I made an error on review. I've looked at it. It shows left bundle branch block. I asked it, so why did you make the error? And then it said to me, oh, it is very, very complex to read ECGs, gave me a very generic, politically correct answer. And then I fed the same ECG again, and it tended not to make that mistake again. So it gave a signal that, gee, it was learning from its mistakes. So here is, based on the things that I saw, these would be my recommendation before we get to the live demo part of this talk. If you want to interpret ECGs, you must learn ECG reading. There is no shortcut. This is not the technology that you can just picture it with your phone and it'll tell you. This is not the Shazam of music that it'll tell you who the musician was, etc., etc. AI can augment your learning process. It can make it simpler, easier to your learning style. AI cannot replace you. This is, I think, a fairly confident conclusion I can make for today. Again, tomorrow is a mystery, but today, the present, it cannot replace you. However, doctors and clinicians who use AI will replace doctors and clinicians who do not use AI. This is my firm belief, because this is more about efficiency and tools, just like, engineers, if they said, I don't use a calculator or some of the tools they have, it is hard to practice. So are we ready to try something live? Okay, so let me see. So this is the chat GPT screen, and I understand that some of you have not seen this before. So I'll walk you through. On the top left that's the sidebar. This is the new chat. To start a new chat, it tells you which version of ChatGPT you're using. You can use ChatGPT 40 or 3.5. 3.5 is free, and 4 and 4.0 are the paid versions of ChatGPT. So all you got to do is message ChatGPT, and I would say think of this as a person that you're interacting with. So I'll say, because it is morning here in Canada, good morning, and it'll give you a very courteous message back. Good morning, how can I assist you? And we say, I am sharing your capabilities for ECG reading. Are you ready? Okay. So it says, yes, I'm ready. And again, I didn't have to do this, but I said, let's be polite and nice. So all I'll do from another screen, which you are not able to see yet, or I will not have you see that screen. I will just copy and paste an ECG. And so I've snipped it and I paste it. As you can see, it's a little pink icon. The ECG is uploaded. I hit the arrow and you can see the ECG that is up there. It says, thank you for sharing the ECG. It tells you here are some things to consider, and it is trying to give me a general thing. And from a quick glance, it says the ECG, the rhythm appears to be regular, the P waves are present, and those kind of things. And it says for more detailed analysis, ask more or whatever it is. So please, I will say, please provide a report. I am a physician. So it goes ahead, it'll think, and it says it didn't find any patient name, etc., because there was none. And then it said the heart rate, it will try to calculate again, and it is giving you a lengthy report. You can shorten it as much as you want, but it is literally saying that interpretation, this is a normal sinus rhythm ECG, no abnormalities are detected, which for this ECG is the correct answer. No immediate intervention is necessary based on this ECG, clinical correlation, etc., etc., and it is willing to sign off on your report if you let that do. Let's try to give it something that is not normal and see if it, which we all will agree, is not normal. Those of us who are used to seeing ECGs. So, and let's see how accurate it is. So this is another ECG. Let me know if you can you see the ECG?
Yes, we can see the ECG.
Okay, so this is the ECG. As those of you who read ECGs, this patient has a pacemaker and clearly has a pacemaker. And here's what it says. The summary interpretation is irregular rhythm, likely consistent with atrial fibrillation, no ischemic changes needed. So it was 100% wrong on this ECG. This is a paced rhythm, but because it was slightly irregular, it went on to say that this is an abnormal ECG, and it was also incorrect about the abnormality that this ECG had. It was a clean ECG, it wasn't color, and you could realize that. Now, let's try to ask it, don't you think this one has a pacemaker? Don't you think that the patient has a pacemaker based on this ECG? And it'll think, guess what? It says, you are correct. Upon closer inspection, this ECG indeed shows characteristics consistent with a pacemaker, and it will tell you what was those correct characteristics, etc., that why it said it had a pacemaker in there, because it says regular rhythm pacemaker spikes indicating ventricular depolarization. Now, if you say, why did you make that mistake? So you can play around and for a long time trying to learn and those kind of things. And it says, I apologize. The oversight is my initial interpretation. Recognizing pacemaker spikes can be sometimes be subtle, and I appreciate your correction. Here's the revised report again for clarity. So again, you need to know your basics, and this can augment it, but it will not necessarily replace, and certainly it is not the only tool you should use. It can make you look like a fool because the ECG analysis, the person who you send the report to, they'll say, you know what, you don't know what a paced rhythm looks like, or what does atrial fibrillation look like if you call a paced rhythm atrial fibrillation. So that is in terms of doing this. Now you can do the same thing on a different model. This is a model called Perplexity, which is slightly different than ChatGPT. It is made by another company. And what I also did was said, let's give the same ECG to another thing and another chat model and see what is the quality of interpretation. So let's tell it the same thing. Can you help me read an ECG? So it'll say, yep, certainly reading an ECG is an important skill. It gives you a long-winded answer of what the norms are, what it'll look for, etc., etc. And it's ready for us to upload an image. The summary of this, if it worked, which I apologize, it didn't work for Perplexity, is that it will also give you the same thing, but in a slightly more collegial way. So it will be less sounding more like human-like rather than totally like a machine or clinical algorithm. So that part is sharing on the ECG. I'll go back to the non-live demonstration. Let's go back to it. Okay. So in my personal experiment, again, I would say that it is not ready for clinical use, that you can just do put in an ECG and think that it'll give you a right answer. It will make you hit a panic button at times. It'll say show the heart attack when it doesn't. So it's not ready for use, but it is really ready for you to learn how to do ECGs. And again, this was with my limitation. Now, again, coming back to it, that yesterday was history, tomorrow is a mystery, and we are in the present. I would say keeping the learning going, doing good work while we smile is the way to go. And I will open it up for questions because we did want to leave a good amount of time for questions.